Hi, I am Dr. Imran Khan, consultant internal medicine at Care Hospital Mushirabad, Hyderabad. So, uh, the topic of this video is what are the long term implications after the COVID infection. What I have observed with my experience, I can tell you most of the patients after COVID, they have symptoms for few days, maximum for a week, and after that mostly the symptoms subsides. But I have observed that there are few patients in which the symptoms or the problems can be long term. Long term means maybe weeks or months. So what are those? What are the long term implications of the COVID infection? First, the most commonly what I have observed is patient will have fatigue while after doing a short physical activity they will have tiredness. This is one of the most common symptom after the infection is recovered. So we are talking about the long term implications. It means that COVID infection has gone. The COVID infection has gone, and after the COVID infection, these are the complication post COVID period, in the post COVID period. The second thing which many patients experience is the pains. Like some will have muscular pains, generalized body aches, some will have multiple joint pains, some will have headache. This is also one of the common things during the post COVID period. Third thing, relate particular to the lungs. Patient will have dry cough even after the recovery from the infection. Patient may have shortness of breath for the long duration, for the months. What happens in some patients, because of the COVID virus, there is a damage or injury in the air sacs, we call it as a alveoli, and after the injury they heal by scarring, we call it as a fibrosis. So the lung fibrosis can be the reason behind the long term cough or the long term shortness of breath in the post COVID period. Then if you talk about the other system like cardiovascular system or heart, patient experiences, few of the patient experiences palpitations after the COVID infections for a long time period. It is seen in the COVID there can be a damage in the cardiac muscles which leads to the decreased capacity of the cardiac muscle, and these patients with the severe COVID or moderate COVID, they are very high risk at developing cardiac failure or other associated cardiac diseases. This is one thing. The third organ which is affected, like we can say the nervous system. In the nervous system, patient have different kind of mental disturbances. Patient reports with decreased sleep, decreased concentration, decreased memory, or also some of the patients have depression after the COVID infection. So these are the related to the mental system or mental disturbances post COVID period. And some of the patient also had a brain stroke. Some of the patient also had seizures, also had like temporary paralysis state like Guillain-Barré syndrome following in the post COVID period. And when the COVID happens in the elderly patients, they become high risk to develop Parkinson's or Alzheimer's disease. These are all complications related to the nervous system. There is one more complication related to the blood clots. Blood clots are formed in the blood vessels of different organs. Like if the blood clots are formed in the blood vessels supplying to the heart, patient will have heart attack. If the blood clots are formed in the blood vessels of lung, patient will have pulmonary embolism. If the blood clots are formed in the blood vessels of brain, patient will have brain stroke. This is one of the complication. Another thing, when the patients are on ventilation for long period of time, they have their own issues, like they may get superimposed infection, they may get complication related to the tracheostomy, they may get complications related to the poor nutrition, and so on. This is altogether a different chapter. And finally, some of the patients have fever even after the recovery from the acute actual infection. The patient continue with the fever. So this is also one of the complication in the COVID, in the post-COVID period. So this whatever complication I have listed, some of them can be prevented if we act in a time. Some of them can be treated, and some of them are self-limiting. They decrease over the period of time, and some of them can remain lifelong. So these are the post-COVID complications or implications after the COVID infection. So I suggest you to take proper advice and treatment from the treating doctor. Thank you.